Good afternoon, and welcome to the Rocky Mountain MS Center's webinar series, Maximizing Lifelong Brain Health in MS. Today's topic is making exercise a part of your life with MS. This presentation features Dr. Jeffrey Hebert. He's the Assistant Professor duly appointed in the Departments of Physical Medicine and Rehabilitation and Neurology at the University of Colorado, Denver Anschutz Medical Campus. He's the Director of the Balanced Performance Laboratory and a multiple sclerosis certified specialist. This webinar is scheduled for 1 hour. The first 45 minutes will be Dr. Hebert's presentation, and we'll reserve approximately 15 minutes at the end to answer questions from the audience. You can submit questions at any time during the hour by typing them into the chat window on your screen. We do have a large audience today and therefore may not get to every question. We will answer as many questions as time allows. With that, we'll turn it over to Dr. Jeffrey Hebert.
Thank you very much for everybody attending. I don't see you, but I can see that you are here and present virtually. So thank you very much for attending. And I would like to thank the Rocky Mountain MS Center, my partners here who are putting this wonderful webinar on. And I'll go right into the talk because a very nice introduction of myself was already done. So that was fantastic. So the question is, to all of you, do you exercise? And if so, how often are you exercising? And so you can go ahead and choose each one of those or one of those. And so we get a feeling of how much you are exercising just overall quantity-wise. So as those results are coming in, we're going to lead into the concept of exercise as a general rule of physical activity. So the physical activity can be something that is not just related to MS, of course, in persons with MS. This is something that I could talk to anybody off the street with or without MS and have these similar conversations, but it's just that much more important for persons with MS because the amount of physical inactivity obviously coincides and correlates with MS and obviously the progression of MS. So I think that that is something that's concerning overall. So it appears that many of you are exercising to some degree, and I think we need to look at the definition of exercise. And I think that if we look at exercise as physical activity and how we can put that in our lives on a daily basis, so if we look at this slide, all the way down at the end is the modes of exercise. So free living physical activity versus prescribed structured exercise. So many times when we say exercise, we fall to that last bullet point saying prescribed exercise, it has to be structured, 3 sets of this and doing these many exercises. Before you know it, you don't have any time in the day to really do anything else. So that's usually the concept of I don't have enough time to exercise. But I want everybody here in the webinar and beyond to think that exercise can be something that is more physical activity throughout the day. So the experts from many different associations, American Heart Association, the American College of Sports Medicine, finally came together and said, you know what, I think we should think of exercise as being a very important thing and even thinking of it as exercise as medicine. And you can always go to this free website. It is provider and patient and layperson friendly resource to look at different aspects of exercise so that exercisemedicine.org is a nice resource for you. But this is a general rule for exercise. More specifically for persons with MS, we borrow from our friends from the north in the Canadian Physical Activity Guidelines from their society, and a lot of us here are supporting these general guidelines. Now you can kind of ignore the age range there of 18 to 64 because obviously if you're younger than 18 or older than 64, it still applies. I don't know why they limited just to that, but they're saying within that range. But 30 minutes of exercise, moderate intensity, aerobic activity, as well as some strengthening exercises as well, in general. And in general, what that looks like is and this is actually something that if you just Google the Canadian Multiple Sclerosis Physical Activity Guidelines for Exercise, this is public domain, so you can always get this off the web free of charge, of course. Here's what is recommended overall. How often, how much, and how hard, and how do I do it? And I think some of the questions that were sent in prior to, which was fantastic, educated questions that were sent in prior to the webinar, are asking these questions, are asking how often do I do it, how much, and how hard, and what are the modes of exercises. And you can see it's a fairly laundry list of like, how can I do it? But us as exercise specialists, and especially specialists in MS, do still have to provide you with some guidance on how this relates to you as a person with MS and living with MS for pretty much a lifetime. And so if we look at the overall concept, this was actually something I came across in Chicago because Chicago has fantastic museums, and I came across this exhibit that was staying active. And if you look in the foreground, there's a wheelchair. And I thought that was like, they are getting it. They get it. And there's an amputee device in the background as well. And you can see that they're saying staying active even no matter what your disability level is. And I do support that. And my good friend Plato also supports it as well. He's not my good friend. So again, physical activity, it does not have to be sitting on a bike and riding it for 30 minutes. It can be anywhere from taking a hike and enjoying the outdoors, to doing some yard work, to enjoying something out in the great outdoors in the winter as well. But overall, living a healthy lifestyle and how that relates to brain health is not only exercise, but also nutrition. So today's talk is not going to be touching much on nutrition at all, but my general rule when I talk to my patients in the clinic is generally eat as many foods that do not have a label, and eat a well-rounded meal, obviously vegetables, lean protein as much as possible, and just match that with your activity, as well as the wonderful advice that you should see about a quarter of your plate on the plate when you serve yourself dinner or even lunch. So that would be something that it would be advised for anybody living on this planet. For a person with MS, it's that much more important. So as far as what types of exercises, so when we talk about strength training, I like to see my patients go through the exercises that are most important for them, and that means usually the muscles that are weakest, but also maybe some that are your strongest that can help the weaker limb or leg. And so in this case, I like to say look and feel. So it's like, how much intensity do I do? It should feel somewhat hard when you're doing your repetitions. You should never exceed 15 or 20 repetitions with those exercises. And then, as far as the look and feel, that means that your first repetition and your second or third or last repetition should look like it's going through that whole range of motion without having to compensate for it, and that you are moving up that ladder of somewhat hard in effort, but never going to that concept of, I can't do the last repetition very well. And it's been definitely shown that even participating in about 1 set repetitions and repetitions from 1 to 20. So if you're able to move, whether your disability is somewhere where I can only move my left arm or move my right hand, you need to move as whatever limbs you can, as much as you can, but within the realm of not failing that activity, so not pushing it to the fatigue point too much. Endurance exercises or aerobic training is very important as well, and that's something also directly related to brain health. So usually the aerobic type of exercise, and this was a question that was sent in prior to the webinar, what type of exercise is most important for my brain? And I think if we fall back on that physical activity is still exercise, it is also something that you enjoy doing. So if you enjoy riding a bike, that's fine, but if you enjoy doing something outdoors or you have to get something done at home, you have to implement your exercises in your daily routine, and I'll talk a little bit more about that in a little bit. But when it comes to endurance exercises, you want to try to, and we fall back on the American Heart Association's recommendations of anywhere from 30 to 45 minutes per day. And this does not mean that it has to happen all at once. So that arrow coming from approaching intervals to continuous, that means that you are intermittently exercising and making sure that you are managing your fatigue at the same time. So when we talk about physical activity throughout your entire day, again, it does not have to be on a piece of equipment that is exercise equipment. This could be something that I'm cleaning my house today. I need to clean the house, but instead of cleaning the entire house, which usually then results in some leftover fatigue that can last for hours or even into the next day, is to make sure that you're doing these in intermittent intervals and then possibly working up into more continuous, where you are doing maybe 30 minutes of a continuous endurance exercise. And this, again, the mode can be anywhere from walking, if you're still able to run or you are an athlete. And that kind of goes to where I usually approach each of my patients in the clinic and anytime I see someone, is I will definitely see you as an athlete. And you need to think of yourself as an athlete and train yourself as such as well. But thinking that you can implement exercise in your daily routine, that could be something that you would normally do throughout the day, and just purpose that as exercise. And then how do you monitor your compliance to your exercise? How do I know that I'm actually staying on course? So there's definitely the move in technology now for wearables. I'm not going to mention any brand names because I also don't have any financial agreements with any of them, but I just don't want to mention any of them. But any of them that might be measuring your steps per minute and or per day, those are also very, very helpful. And then also maybe monitoring your heart rate during that time. And then simple rating scales, there's one that's been proven to be valid in persons with MS, and we do implement this in the clinic on a regular basis. And it's the rate of perceived exertion by Dr. Bohr way back in the late 1990s. And his scale is very much of a European scale, that it's from 6 to 20. But sometimes we say, just go ahead and modify that to 0 to 10. But on this 6 to 20 scale, I always want you to try to think about exercising or being physically active in the zone that is going to be safe for you, that is moderate exercise or moderate activity. If you start to push into the hard and very hard regions, that's normally where you start to get some of the residual side effects, and typically that is fatigue. And so being able to stay out of that red zone, not getting into that red zone very often, you can use this as a self-analysis of, am I getting past this 12, 13, 14 range? And just do not spend too much time beyond that throughout your entire day even. So some of the questions that you might even be asking yourself, and some of the questions that were sent in are, what are the biggest challenges you face with incorporating exercise in your life? So if you take some time to fill out this multiple choice, choose all that are appropriate, so you can choose as many as you want. And we say that this time because there are probably multiple hurdles that you have to get through or around to engage in exercise. So I'm definitely seeing some of the things that do not necessarily surprise me, but what we're seeing is a big response on fatigue and mobility and balance issues. So how do I engage? And that was definitely a question that came in prior to the webinar, is how do I engage in exercise if I'm not even safe being able to move around and I feel like I'm going to lose my balance when I'm engaging in purposeful exercise? In pain. Yeah, so I think we're hitting definitely the areas that I see that are very practical for persons with MS, which is the fatigue and mobility and balance issues. And also the concerns of safety, that kind of goes with the balance as well. But also it's, how do I know what I'm doing is really beneficial? So I'm going to move on to the slide that kind of is asking the same questions or the concerns from a very large survey that was done in 2011 that are asking those same questions that you're seeing. Feeling like I can't do things correctly. How do I know I'm doing them correctly? Concern about safety. That was the very question that we had on there, and some of you answered that as such. And feeling what I do doesn't help. So that's somewhere we have to be as providers and people that help guide you through this is how do you monitor improvement? And that was a question that came in prior to the webinar too. How do I monitor? What are the outcomes I can use that we use in the clinic? How can I use that as a patient in my daily routine? So those are nice things to think about, is like, how do I know I'm actually improving? And that's something that clinicians need to help you go walk through. Lack of information about what to do, and there is that last part, lack of help from healthcare professionals. I'm a little discouraged about that as being a concern for patients with MS, because that's me, and we should be helping you a lot more, guiding you through, and as early in the process as possible. So when we talk about adapting exercise based on disability levels, the one thing that we are looking at is, there's disability levels that can range from I don't have any disability. That means usually minimal limitations in being able to still be employed, being able to do all the things that I did prior to my diagnoses without limitations, to the spectrum where there's wheelchair and bedridden stages of disability. So again, being ahead of this curve of the disability is really essential. And that's where we have to help you start that process, go through that process early so that we might be able to improve the overall brain health and reduce some of the disability that you may possibly accumulate with MS over time, or what we don't know about benefits of exercise is possibly reversing some of the disability. So one thing as you look through this slide, as I'm talking about other things, you're doing multiple things at once. That's fantastic. So you can see one thing that doesn't come off of this, no matter where you are on the spectrum, exercise, physical activity doesn't come off. So you might have to adapt the exercise. And there's obviously the questions in the clinic as well as ahead of this webinar is, how can I exercise if I'm in a wheelchair? And there's definitely ways you have to exercise, but you will definitely need to adapt that more. And that's where the MS certified specialists, physical therapists, occupational therapists need to help you initiate that and then carry that forward at home or in the community with possibly even a day program that such as is offered at the Rocky Mountain MS Center, where you can go through the adaptive type of exercise that is needed. But not thinking that because I'm disabled so much, it's not worth me exercising. That is definitely not what we're seeing here. And I don't support that concept. An important first step is to undergo a thorough neurological and physical exam. And then that's followed by consultation by an expert that is obviously an expert in MS as well. And unfortunately, there are a few of us out there to search out, and hopefully here at the Rocky Mountain MS Center we can help you locate those experts in MS and exercise and prescription so that we can help guide you. Because if you go back to that survey, that large survey, the last one was lack of guidance from healthcare providers. And that's where we need to step in, and we will attempt to help you as much as we can. One thing about whether you're a current exerciser or you are not an exerciser, if that's a word, is that you might be going through steps of change in incorporating this into your daily routine. And you have to go through stages of, maybe even there might be one off of this slide that is pre-contemplation. Contemplation is thinking about it. So you might not even, If you're engaging in this webinar, you probably have engaged somewhat. You've thought about exercise. But there might be some people outside of this webinar that have not even thought about exercise being important. So pre-contemplation is a very important stage that we need to capture those people, move you through these stages and guide you through these stages of thinking about engaging in a more healthy lifestyle, physical activity, and, adopting that as a lifestyle, then initiating it, and most importantly, adhering it over time. And as humans, we tend to fall down these steps, but we need to get back right on those steps and get back to adhering to an exercise program. Common barriers, these were brought up. I mean, fatigue, pain, depression, and mobility and balance. So let me hit on first probably the most common is fatigue. Everybody knows that the most common symptom of in MS is fatigue. So obviously it's very, very prevalent. There is a concept of fatigue that has to be differentiated out into two types of fatigue. One is symptomatic fatigue and one is performance fatigability. I can't get into too much about this, but in general, usually what we think about as quote-unquote MS fatigue is usually that symptomatic fatigue. I'm feeling tired, not necessarily sleepy tired, but I just don't have the energy. And as the day goes on, the more things I do, I get more of this perception or symptomatic fatigue. I perceive I have more fatigue. The latter of that type of fatigue, performance fatigability, is more specific to muscle function. So if you're going for a walk and all of a sudden your foot starts to slap after about 5-10 minutes of walking, before you know it, it starts to drag and you're like, what is going on? That's not necessarily symptomatic fatigue, that you're feeling more tired, but your muscles are being pushed beyond their limits, and that is engaging in exercise and activity for a little bit longer than the muscles can take. So I really push that you do not exercise to the point of performance fatigability. Symptomatic fatigue is a problem and needs to be addressed. Balance overall is very prevalent as well, as everybody knows. And impaired balance and symptomatic fatigue are, when they come together, and often they do come together, is that they're contributors to poor quality of life. And the list of those concerns that limit you from engaging in exercise more often is that the barriers of balance and fatigue need to be maybe addressed prior to, or maybe even separately, to think that to engage in more physical activity for a better fitness level, brain health, is that I need to address some of the hurdles first. So just to give you some advice on a program that I designed years back from the clinic and then put it to some of the research that I've been doing, is the BEAMS program. So this, in results that we've found, is it looks like we'll be improving balance, which we do with this program. And it's implemented now at the Rocky Mountain MS Center and our clinicians here that treat patients with MS on a regular basis. And I just met someone yesterday that was seeing one of my former students who was also a physical therapist, and they said, this program was like one of the best things they've ever done, and was really helpful and able to get them over some of the hurdles of, I no longer have my balance problem. But with this program, the way that I've designed it is it also helps with balance, fatigue, dizziness in the current research that we just finished, improving quality of life overall, as well as some early signs of possibly even self-reported cognition as well. Obviously, we're going to push this research forward and get this translated into clinic for those purposes. But please reach out for this type of program in order to get over some of those hurdles so that we can get into the most important aspects of engaging in more physical activity and healthy lifestyle. Obviously, there's additional barriers that might not even be addressed today as much or even brought up. But obviously, transportation, access to resources and finances, not all of us can actually, spend the money to go to a fitness center, but we can purpose the exercise and not cost us anything if we think about it as implementing it in your daily life. Limited self-esteem and self-efficacy. Again, that question of, I don't know what's really helping me, and I don't know if I can really engage on this on a regular basis. But you need support, and you can't always do it by yourself, so you need help from likes of myself. Enhancing that change in adherence. Think about self-rewards. How can you reward yourself? I'm not saying, eat a gallon of ice cream after you exercise or anything like that, but give yourself something that you feel good about. I've done it, and because a lot of times it's not good enough to say, ooh, I've done that. That's really good for me. So think about maybe giving yourself some rewards. Writing goals, like your own behavioral contract to yourself, and making sure that you're adhering to your own rules rather than someone else setting the rules for you. Self-monitoring, we talked about that. Using environmental cues. It used to be the sticky notes, but when we have our phones now, we can actually have alerts on our phones, our smartphones. We can do it that way. And then again, compensate for barriers. I talked about maybe conquering some of your barriers with maybe like the BEAMS program, but compensating for those barriers in ways that you can engage in more physical activity, and that could be something that you could implement in a different type of walking device that is more suited for your needs. And all the way back on the bottom here is use a personal trainer. And I put that in quotations. Be very, very careful about reaching out to the typical personal trainer that might be in a fitness center, making sure that that personal trainer is trained and knowledgeable in MS as well. That's always something that you have to lead with. Other things to consider is heart rate and blood pressure response to exercise. Some patients with MS, heart rate is not something that we can rely on, and it's not a valid measure of your intensity like we would in persons that do not have MS. That's not everybody, but certain patients with MS, that's called blunting of the heart rate, and the more you exercise, your heart rate can't match that rate. Now, in the clinic, we do some initial assessments for that to determine if you have that and if you are able to use your heart rate for monitoring intensity. Heat intolerance, everybody on this webinar probably knows that the thermal sensitivity, the heat, it's hot out there right now, and being able to manage your heat intolerance while you're exercising is very important. There's obviously cooling vests and those types of devices, but also what I support is sometimes you can't get yourself into the realm of sweating, and sweating is where we actually start to dissipate our core temperature. But the sweating and the part of where it then evaporates off your skin, that's the point where you start to cool yourself off. And really, cooling vests really don't do that. So I promote that the use of a misting bottle, not a water bottle that soaks you, but a mister bottle. And if you're exercising on a stationary bike or a stationary machine, that you have fans and air moving so that you're actually cooling yourself off. That is the natural way of doing it. Is really important to stave off and be ahead of that fatigue curve due to heat intolerance. And then again, muscle fatigability. Respect that fatigability. More is not better in the case of fatiguing your muscles out. It's not that we don't know if it worsens your, quote unquote, worsens your MS. It certainly doesn't do well for functioning after fatiguing your muscles so much to where you cannot get off the bike without falling, or being able to walk away from that exercise because your leg is really starting to drag now. That's going beyond, and that's where I think exercise 20 plus years ago was a really bad thing because we were not implementing the exercise program accordingly to and respecting that fatigability of the muscle groups themselves. And just knowing that if you're engaging in something that requires equipment that you're going to maybe having to spend the money to get that, and maybe you need to think about some low-tech ways of incorporating your exercise. Overall, you got to find that path. And I was doing a run in Sonoma, and luckily I had my phone with me, and I took a picture of it because this is definitely the quintessential is get through that barrier, stay on that path, and just think about empowering the empowerment that you get by being able to overcome some of these barriers and do something very purposeful for yourself. It can be extremely strong. So our last question, coming from me, is what do you think are the benefits of exercise in MS? And again, choose as many as you believe are appropriate. I just read that off there. That shouldn't be that way. Choose as many as you want. So I'm seeing some of the results come in, and there's not a lead horse here. I mean, we're going to have like a photo finish, and this is really, really great, because I think if I would have asked this question 10, 15, 20 years ago, there could have been some goose eggs here that it's like, I don't think it really does anything for me. So these are fantastic responses. Just to let you know on this end, all your responses, that each one of these can be improved, enhanced, reduced, whichever you want to say it, by exercise. And I completely agree. And everybody is individual, and that's how we treat, how I approach each one of my clients or patients, is that you are an individual that just so happens to have MS. And now exercise is going to probably and most often improve most of these aspects that we see here. So that's great responses. So in general, you know, what is the cause of progressive disability in MS? As we know, we don't have a cure for MS. So the ongoing disease activity itself, even if you are no longer going through any of the relapsing portions or having exacerbations, or maybe never have had, but still obviously diagnosed with MS, the neurological system is still going through a downward spiral as far as the disease continuing to hamper the neurological function, and that includes your ability to function throughout your day and in your environments. And loss of function due to disuse. Now, obviously, directly we can't really do anything about the disease necessarily that we know of with exercise, but I'll come to that later. We don't know yet, but this second point here is very important, that at this given point, because of the disuse or the lack of activity, that the effects on the neurological system and the musculoskeletal, that means your bones and your muscles themselves, irregardless of the neurological system, are definitely going to be, like anybody that is not participating in exercise, can get worse. So taking from one of my colleagues, Dr. Leslie White, did a great piece back in 2011 about the benefits of physical activity. Now, we always fall back on that laundry list that we looked at. But again, today's topic also is touching on brain health. And what we know about in animal models, but also some of the human humans now in research, that brain health, because of exercise, can be enhanced. And all of those tricky words you see there is protection, is regeneration, genesis, and plasticity. It's very possible that physical activity can possibly push these in the right direction for brain health. And that's very exciting. We're at the doorstep of understanding exactly what this is in anyone that engages in exercises, but especially persons with MS. And could it help with the actual inflammatory process of MS itself? And then ultimately, the bottom line is, that's all fine and good, but what about my disability in enhancing my overall quality of life? And it can lead to that. So again, a lot of the studies for protection of exercise and disease modification due to exercising comes from animal studies, but we are also seeing human studies as well. This is actually a study that was done and looked at the correlation between exercise, the amount of exercise per week performed, and then looked at that and seen increased brain volume in a very important, very specific area of the brain called the hippocampus. And it's a small, even though hippo you think big, it's a very small part of your brain that is really important in cognition and attention to task. And this was actually outside of the realm of MS in healthy individuals without diagnoses of any kind, and it looked at the volume of the brain increased over time with more exercise and more activity. Spontaneous recovery in MS occurs in the brain, spinal cord possibly. That's where we get some of the remission after an exacerbation. It never is complete, however, nor is it consistent. So exercise and activity and coordinated actual task performance can actually help with neuroplasticity. And that can be helped by what we call neurotrophic factors, which is basically the chemical release from exercise that in human beings that I call it as the fertilizer for the brain to at least attempt to improve neuroplasticity or brain health. And this is a combination group of where we saw land exercise versus aquatic therapy. And that was a question that came in prior to the webinar, was aquatic therapy, is that beneficial? And in this case, it showed that actually the neurotrophic factors in your blood with persons with MS actually increases in water, but also on land. So irregardless of the mode of exercise, you can improve the possibility of your brain being healthy because you've got the fertilizer moving through the brain. So again, the last bullet point of why am I progressing in my disability with MS is obviously age, and you are aging with a neurological condition. And I highlight the first 5 years of this study that looked at progression of disability over time. So as we look at that DSS, which is a disability scale, we go up that scale. That means that you are now maybe needing more assistance for mobility primarily. But if we can capture that first 5 years, can we draw out some of those individuals that took a lot longer to get to that disability? So those long lines below that red line, those are the individuals that took longer time to actually get more disabled. So can we, with exercise possibly, again, be ahead of the curve, push those lines from the left and draw everybody out to being less disabled? With age, obviously, we are going to become a little less functional, but can we draw that out a little bit more with exercise? And borrowing from other areas of neurological conditions is in the realm of Alzheimer's disease. And even, no, I shouldn't say even, but also in that realm, in thinking about obviously dementia and brain health and cognitive function and cognitive reserve, and our colleagues from the Alzheimer's realm are also thinking that improved exercise and the concept of the CVD is cervical vascular disease or heart disease, and they're seeing that as if we can improve the overall fitness of individuals, can we stave off the brain atrophy that can come from disuse, and then decreasing the amount of cognitive effect of being more inactive. And then also the benefits of, do I get stronger when I exercise? And these are slides that I've been using for years, since 2011, that shows that there's the EDSS, and there's 3 different segments of disability in this study. The triceps is a muscle group in the arms, and they have many of these graphs in their paper, but I just selected one for the upper extremities and for the lower extremities that showed that all groups, again, no matter what your disability level is, projections were paralleled, meaning that you, no matter how disabled you are, no matter how weak you are at the beginning, the baseline from left to right over time, after 3 months of exercise, after 6 months of structured exercise, there's gains in strength itself. So obviously we would like to think of that also improving overall function, but this is a great illustration of, again, am I too disabled or am I not disabled enough to gain benefits from exercise? And this is a great illustration of, yes, you can gain no matter what your disability level is. And overall, you just got to be extremely purposeful in your engagement of exercise and thinking about it as anything you would do on a daily basis. And again, always thinking that it's tough to engage, and I always say I exercise daily, but I always say the best thing about exercise is when it's done. When it's done, you know you pushed through it, and think about your mental fortitude and being able to get over some of that mental barriers of self-efficacy and self-esteem. Think about pushing through those barriers as well. And again, we'll help you move through those stages as much as possible. And I think we'll open for questions.
I get concerned that if I do the same things all the time, I may not improve as much as I could. How important is it to change things up a bit?
Yeah, that's a great question, and that kind of goes to the concept of cross-training. And again, I'm treating everybody as an athlete. So when we talk about exercising one type of mode of exercise, it is best if you could engage in multiple types of exercise. But I think when we talk about brain health and overall fitness health, I do tend to lean towards some type of endurance-related aerobic type of exercise. Again, this could be anywhere from walking your dog to cleaning the house to while you're at work, pulling yourself away from the workstation, going up and down the flight of stairs 4 or 5 times a day. Before you know it, when you do that throughout the entire day, you can add up the 5 minutes, the 2 minutes, the 10 minutes, and the 15 minutes, and now you have accomplished your goal of being physically active for 45, 60 minutes or more a day. And that could be different modes of exercises. So you can always choose your favorite mode, but you might want to think about addressing your weak muscles with some strength training specifically, getting some guidance on how to do that, and then aerobic or endurance exercises, be more physically active. And it could be also engaging in something that is helping you with overall mood and mental capacity, and something that you enjoy. It could be yoga, Tai Chi, meditation itself as well. So you can hit it at different levels, but probably lead with being endurance heavy.
Dr. Hebert, we had a few questions about the BEAMS program.
Yep.
Is that something that's specific to the MS Center here, or is that something that others would be available elsewhere to others?
Yeah, so my push over the last few years is I'm trying to train as many people in the state of Colorado, in the neighboring states, in training clinicians, physical therapists that are very knowledgeable in MS, and training them in the BEAMS specifically so that they are certified BEAMS providers. So there's few of them, so I can always lead you into searching that out. I've done the training in Colorado Springs and Fort Collins. I will be doing that training again over on the western slope, and I've done it in Nebraska as well. So we have our network starting, but here at the Rocky Mountain MS Center, we definitely have 3 of us that have that knowledge to implement that. So, and it does not take any necessarily equipment. It could be something that could be 1 or 2 sessions to get you started with the BEAMS and come back for follow-up studies or sessions as well. So yes, it's something that you'd have to be instructed. It really can't be given like a handout and say, here you go. We can't really send that over because you have to do it appropriately and know what's some of the expected early symptoms that you might get from engaging in this, because it's something that you normally would purposely or not even knowing, you would avoid such type of tasks, and it would challenge yourself that we need to monitor that as best we can.
What suggestions for exercise do you have that can be done when walking is very painful?
Yeah, so then if it's more the painful, the symptom of pain is due to weight bearing, one could reach out to aquatic therapy because of the buoyancy of the water. It is a really nice environment to begin exercises for anyone, possibly. But if there's pain due to repetitive, stepping, walking, and that's because the ground reaction forces are too much to handle, that the aquatic environment could be a good choice. It also could be something that is more of a stationary equipment that you're not weight bearing and continuously loading. An example would be like a stationary bike, or even a treadmill. If you really want to engage in walking, the treadmill versus ground walking, because of the buoyancy of the tread, you just have to make sure that you're as safe as possible and have the safeguards already implemented for the treadmill, so you don't trip and hurt yourself. Make sure safety is first, but then think about that the tread does give a little bit, so if the pain is due to that. If it's not due to that, there might be other areas, might be spasticity that's causing the pain, and then you'd have to engage in more of a stretching program, and then maybe lead with stretching, then do your walking, or the vice versa. So there's obviously multiple factors that can lead to pain, but those are maybe some of the ones that come to the forefront of my thoughts that you would have to address. Again, barriers to exercise. This might be a barrier to use those to get over that barrier.
We have another question that's specific to hydrotherapy. This person says that about 30 minutes of her hydrotherapy class is aerobic and 30 minutes is strength training. So on off days when hydrotherapy is not going on, should you continue with strength training, or should you give yourself a break from strength training?
Yeah, I think for the strength training, it is very helpful to take a day in between rest, because the muscles do need to recover. If you're taxing the muscles appropriately, again, not taxing them, meaning going to the point where you cannot no longer do that last repetition or that last minute of the exercise because your leg is starting to not move as much or your arm cannot lift it as well. You do not want to go to that point. But you take it appropriately to the point where it can continue to function and benefit from that engagement of strength training, that you definitely still want to take a day rest from that. Going back to the pain as well, there was a question that I did come across prior to the webinar that said, I get pain because, after exercising. So there is a normal response to engaging in exercise that is muscle soreness. And there's a delayed muscle soreness, and it's a fairly phenomenon, but it's physiologically supported, that when you are exercising, there could be small changes in the muscle that result in pain and soreness, but that should be short-lived, very transient, and should go away, and not something that is joint-related. So engaging some of those exercises, again, might be a reason to take a day off in between of your purposeful strength training exercises.
It's something that seems to be related to where you were going with that. You talked about muscle fatigability. If that comes on quickly when someone's starting an exercise program, should they expect it to improve over time, or is that just something that they're going to have to deal with? No,
that's a great question. And that's something I definitely educate my patients and clients, is that these intervals can be very, very small. The on time of exercise, especially if you, let's say, can only do that exercise without the muscle failing, and it's only 2 minutes. Then you exercise that muscle for 1 minute. You stay beyond or ahead of that fatigue curve in that muscle, and then you do that with maybe, it is a bit of a trial and error, and going through it and measure this by weeks and months and years of improvements, not by days, that you look at the muscle needs some time to recover, and thus maybe exercise it for a minute, rest for a minute, exercise it for a minute, and then over time, see, let's say in a month, then try 2 minutes of exercise, then a minute rest. Then you might be up to 5 minutes of exercise. Before that, you start to feel there might be some fatigue in that muscle. And then, again, you can always add up the 5 minutes and the 5 minutes and the 5 minutes. You've got 15 minutes but try not to, right out of the gate for exercising, is to go 15 minutes and then your leg is no longer, or your arm or your body is no longer going to function because it's so weak. So again, making sure that you're not fatiguing so much, but then doing some. You have to engage, you have to activate those muscles and your body, but just making sure that you don't bring yourself to the fatigue point.
A lot of the questions that we received had to do with balance. Do you have any good exercise suggestions for working on balance?
Yeah, so part of that would be the BEAMS program, because balance, that is my expertise, is that balance can be, again, multifactorial. And I do believe you would need a thorough examination to determine what is leading to your balance problem. And it could be anywhere from muscle weakness to sensory loss in the legs, due also to where the brain lesions might be, and affecting the integration of the three main sensory systems in the human body that we use to orient ourselves to space, and that would be vision, feeling throughout your body to give feedback to the brain on where you are on the surface, and then the inner ears, which is the vestibular system. So we would have to figure out if you're having problems integrating those sensory systems, and the BEAMS program would be something that you would be prescribed for sure. But it could be also that your imbalance is due to muscle weakness, that then we might go down more the strengthening route and be very specific to those areas. So it could be multifactorial, and definitely should not be left to, I have MS and I'm going to have poor balance. This is something that can be improved, but you have to be engage in it purposefully and certainly get guidance. This is not, I would caution taking the approaches to balance improvements off the web without being consulted by an expert, certainly in balance training.
Speaking of balance, we got some questions about yoga, which seems to have a pretty heavy balance component. What do you think about yoga as an exercise for someone living with MS?
Yep, and if it's in a class and you're taking yoga with an instructor, hopefully you have a free communication with the instructor or the yogi, that you can let them know that you might not be able to do all the poses, all the holds for the same amount of time that maybe everybody else is in the class, and making sure that they don't keep coming to you and saying, why are you not holding that longer? Again, respect, don't push, don't look around and saying, I should be able to hold this pose for as long as everybody else is. You need to stay within your realm. So yoga is fantastic. It definitely has a postural control, balance component to it. It also has mental health component to it. So I'm very supportive of yoga. If it's need to be something that is extremely adaptive and more so done in a wheelchair, getting some guidance from areas. Now, I do not, unfortunately, have a lot of referral sources for adaptive yoga, but we do have some of those that we can have people engage in more adaptive to their capabilities, but making sure that you engage in it safely and know that it can be something that is definitely beneficial.
We had one person in the audience say, does not so vigorous exercise like walking with my husband or kids help, or do I need exercise to be at a higher level of exertion?
That walk can be, so this is where the monitoring of your intensity, so if you can use that Borg scale to self-analyze your exertion. Wearables are fantastic to monitor heart rate, steps per minute. Some of them are getting pretty fancy about even analyzing balance while you're doing it. But I would say that you're probably getting yourself, if you can be walking with your husband or your care provider, that you're walking, you're probably getting to the point where you're getting moderate level of exercise and you don't even know it. You can purpose that as your time of exercise. So yes, it's possible. Maybe a little bit more of a brisk walk, but that's all up to your physiological response to that particular exercise. It's also the different terrain you might be on. In Colorado, we do have some undulating hills and such. So knowing that once you get and we're at altitude, that you're probably getting into that moderate level of exercise and you don't even know it. So yes, it could easily be purposed for your allotted time for exercise and being more physically active. So I definitely support that. So keep on walking with your loved ones.
How do you motivate yourself when you are fatigued?
I don't have a great answer for that. The motivation when you're fatigued. So I'll take it to even the extreme of fatigue where nap time. So I feel so fatigued that I'm going to take a nap rather than engage in exercise. So I have implemented that a nap of 15 minutes in the day can be middle of the day. That's completely acceptable and actually sometimes very, very helpful. It might be something that we all should do. However, when it becomes a nap time that's more like an hour, hour and a half, that starts to interrupt overall sleep. Sometimes what I say is that at that point, and this is like, again, that mental fortitude, at that point of feeling like you just want to sit on the couch, you do not want to move, that is the very point you just go ahead and stand up and start walking. And if you're able to walk, start moving. Before you know it, that overall lethargy, fatigue that you might get from more sedentary activities could actually start to increase the energy during that time. And a bout of exercise, a bout of physical activity, even within the home, get off the couch, walk into a different room, come back, do that like 3 or 4 times, you now have possibly gotten yourself out of that, I'm tired, so tired that I'm going to sit on the couch. So I've implemented that in the clinic, and it's been pretty beneficial. And going to that pain and fatigue, I just had a patient come back this last week, and she had chronic pain for many years, and she was very much perseverating, always thinking about her pain. She identified with her pain and her fatigue, and implementing these things of parking not next to the door to your work, or you're going to the department store, park away. Purpose your walk into the grocery store if you're able to do that safely. Use that and get away from the workstation. She came back recently after about 3 or 4 sessions, and she was never really talking about her pain. She's like, yeah, I've got pain, but I feel like I got more energy, I'm doing more things, I got a new job, I feel so much better. So being able to implement that in her daily life really helped her. And that's something that, yes, you need some guidance on how do I get over my fatigue to engage in more exercise. Because yes, more physical activity, more healthy lifestyle can help the fatigue, but if you're too fatigued, that's a hurdle that we need to help you get through.
We're headed right up against our time limit here. We have had a lot of questions about the BEAMS program. Dr. Hebert, would it be feasible for us to put something on the MS Center website with some information about finding BEAMS certified PTs around the area here?
Yep, and then also, I think I saw a little blurb on the screen that if I'm accepting new patients, and I definitely accept patients as well, so we can get them to come in to get at least maybe like a little starter kit for the BEAMS, and then in your area we can see if there's individuals that have been trained so far in your area, in your location, and then you can continue that way too. So I'm most definitely open to that as well.
All right, thanks.
Mm-hmm.
We're going to wrap this up and say thank you, Dr. Hebert, for sharing your time and your expertise with us. Thank you, attendees, for all of your excellent questions and also sharing your time with us. We will be posting this webinar on our website under the education section so that you can reference it at a later time. And you'll be sent an evaluation as well, and we would really love it if you guys could fill those out. We do take your feedback to heart. Thank you.